My name is Paul Beninger, and I'm the director of the MD/MBA program at Tufts, and I'm an associate professor. My background is infectious disease. So I came to my professional life at the end of the 80s and the early years of HIV. My experiences there were incredibly traumatic. Everyone died. Everyone died. It wasn't even like oncology. Everybody died. And it was only gradually that we were able to find drugs that worked for the opportunistic infections associated with HIV, that we were actually able to help people to live, at least for the short duration, and then eventually to develop antiviral drugs that were able to protect people from the viral infection itself. It was from 1980 until 1988 before the federal government provided funding to do the kinds of research and work that was needed. So those were very dark years. During that time, the patients who were actually living and then dying of HIV and opportunistic infections were very poorly treated. They were ostracized in their communities. They were shunned. There was a stigma that was associated with it. And with the families, it was a really difficult time, I think. There was not much we could do for them, provide palliative care. That's a lot of how we've actually treated this particular infection, pretending that it doesn't exist, saying that people who try and protect themselves should get rid of their masks and they should get out there and do all the things they need to do, I think is endangering the people who are most susceptible, those with chronic diseases and those who may have other immunocompromising conditions like diabetes. I think there are some societal similarities between how we've treated HIV in the early years and how we're treating coronavirus today. So what's interesting about coronaviruses in general is that they were really first as a group discovered in the 1960s. There was a lot of interest, there was a lot of available technology to understand what the common cold was about. And we learned about coronaviruses, adenoviruses, we learned about parainfluenza viruses. Towards the early 2000s, we started to see another virus that came out, a coronavirus, and we ended up calling it the SARS virus. And what was different about it is that it caused a lot more serious disease. It wasn't the common cold, and it was associated with serious complications and, like influenza itself, death. Then it was 2012 when a relationship of that SARS virus, the MERS virus, showed itself in the Middle East. And so we have a backdrop of a couple of really serious systemic viruses that preceded the occurrence of corona respiratory virus of 2019. So there's a lot of things to go into it. But in the end, if we can recognize how many people get infected by one single person, we have a good idea then of what it's going to take in order to stop the epidemic. When it comes to COVID, we know that the level at which we have to protect the population is somewhere between 50 and 60%. There are three fundamental strategies in dealing with a pandemic. One of them is lockdown. One of them is the incremental approach of masks and being able to contact trace individuals that are infected. And then the third one's the vaccine. We represent abject failures in 1 and 2. And we're left essentially with a vaccine. And it's been a truly extraordinary experience to see how a vaccine's been developed in less than a year. So the devil's in the details. It's trying to actually get the vaccine rolled out, get all the different populations identified, and being able to roll it out in a graduated way. There's always a tussle that goes on about who should be getting the vaccine, and we're seeing that now. The more hopeful part is that in 6 to 12 months, we're going to have 2/3, 3/4, maybe even 7/8 of the population vaccinated by that time in this country. Globally, it's going to be 1 to 2 years. And I think that's actually an extraordinary accomplishment. I think we've been learning some things the last couple of months about what we might be able to do in terms of developing a vaccine for the future, not just to get through this, but recognizing that this is going to happen again. It's not over. And how are we going to be prepared for that? I hope we've learned some lessons from this experience. I hope we're able to carry them forward and actually be prepared, anticipate where things might come, and recognize that we do need to be prepared, because another hit like this is to the global economy, to the global population, is actually going to be extremely difficult to manage. So we need to do a lot more in terms of anticipating what can happen and preparing ourselves as best we can.
Thank you for watching this video, and we would love to share more with you. So please subscribe to this YouTube channel. For more information about all of our trainings, please visit the link below.